If you look at healthcare in America, you're twice as likely to get your knee replaced as you are in Western countries with the same standard of living. You're 2 or 3 times as likely to get a heart catheterization or have a stent in your coronaries. We've set up a system that often pushes physicians and hospitals and the entire healthcare system into doing more. Driven by these perverse economic incentives, we are doing a lot of procedures to people that they don't need. To a man with a hammer, everything looks like a nail.
Okay, ready? Now you want to get the scissors?
Yeah.
I started getting sick in my 30s. I started having really, really bad chest pain.
Here we go, a flower for you.
Oh, it's so beautiful. I just had been ignoring it because I thought, you know, I'm only 34 years old. I can't be having heart problems. But one evening, I sat straight up in bed with the worst chest pain. So I went into the hospital, and they told me I'd had a heart attack. I was 35 at the time and was scheduled for open heart surgery. And I thought, once I get this, I won't have the blockages anymore. You know, they'll actually fix it. Little did I know that it was followed by years of the same thing over and over and over again. A heart cath, get another stent. Heart cath, get another stent. Until my doctor said to me, I don't know what else to do for you. There's nothing else I can do.
Contrary to what most people believe, getting a stent in your coronary, if you have stable chest pain, will likely relieve your pain, but it will not help you live longer, and it will not protect you from having a heart attack. It only reduces symptoms. And the problem is that some of those procedures will lead to bad outcomes.
I started doing research about where in the United States do I have to go to get the best heart care. And ironically, it was only 2 hours away at the Cleveland Clinic.
How are you?
I am great. Look at the thinness.
I know, you look really
I have
good.
lost,
You
since
look
last
really
year, I've
good.
lost 21 pounds.
Oh my God. Yvonne came to see me when she was sort of at her wit's end. She had had bypass surgery at an early age, 27 cardiac catheterizations, and well over 7 stents. Deep breath. This is just an unbelievable amount of stents and cardiac caths. I'm sorry, it's gonna get pretty tight, huh?
Oh,
Sorry. I can't tell you how shocked we were when we saw her the first time. Because here was a young woman whose diabetes was not well controlled, her cholesterol was never well controlled, and her high blood pressure was never well controlled. Breathe normally for me. If someone had talked to her, I think someone had really teased out her chest pain and her shortness of breath, I think many of her cardiac catheterization and stents would not have been necessary. You know, you have all these stents, and you know, these stents, once they go in, they never come out, and they're part of you. Now we're kind of dealing with the consequences. When you reward physicians for doing procedures instead of talking to patients, that's what they're gonna do, is do procedures.
The vast majority of doctors in this country are paid by a fee-for-service system, and that simply means that they get paid for each office visit. If they're surgeons, they get paid for each procedure. If it's a radiologist, they get paid for each CT scan that they deliver.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes on an established visit with a patient to make sure they're doing their exercise, make sure their diabetes is going okay, and to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
Fee-for-service rewards physicians for doing more. It doesn't reward them for doing a better job. It doesn't reward them for keeping their patients healthy. It rewards them for delivering more care.
I was trying to figure out how much Yvonne's care would have been over the years, and I think it's well over 1.5 million. But it's more than cost. It's just so much more than money. The psychological trauma of every one of those multiple cardiac catheterization every time she had a chest pain coming into the ER. And unfortunately, there are lots of Ivans out there.